Hello, thank you for joining us. My name is Miranda Keifer. I'm the community health worker out of our Norfolk office. Today we're going to do a little presentation on immunizations. I have Dr. Rozeboom joining us, and I'm just going to ask him a few questions. So starting with, what are some of the benefits of getting vaccinated?
Well, the obvious benefit, of course, is to prevent serious disease in children, well, adults too, in my case, children. One thing people often forget is the benefit of protecting those around you, those who a vaccine doesn't take as well, or those who are unable to be vaccinated for various reasons. It can help prevent school absences. There's also monetary benefits, such as preventing costs of treating diseases, and also the cost of parents missing work or patients missing work due to illness.
Very good. And what are some of the main diseases vaccinations help prevent?
Pediatrics, there's a fair number. Hepatitis B, tetanus, diphtheria, pertussis, which is whooping cough, rotavirus, polio, Haemophilus influenza B, pneumococcus, measles, mumps, rubella, chickenpox, meningococcus, HPV, influenza, COVID-19. That's pretty much covers the pediatrics.
And then when should a patient start getting vaccinated?
Ideally, that would be at birth with the hepatitis B vaccine. And then under the normal schedule, then we start to give more at 2 months of age. And children get most of their vaccines in the first year and a half or so of age.
Do infants have a natural immunity?
No more than an adult would have. They have the building blocks to produce an immune response. Infants do acquire some what we call passive immunity from the mother to protect from some diseases, and that generally wears off over a few to several months.
And then will the vaccinations or immunizations that infants get, will that overload their system?
Not really. An infant's immune system is really essentially as large as an adult's. Babies are small, but down on the molecular level, I mean, there are a countless number of cells involved. So it's actually a big thing.
Okay. And then are vaccines safe? And following up with that, what are some side effects that may happen when getting immunizations?
Vaccines are extremely safe, especially if you compare them to the diseases that they are preventing. Probably the most common side effects you might see, people are more familiar with, would be maybe a local reaction, some redness or pain at the injection site, fever, irritability. Reaction that people have more concern about would be like a full-blown allergic or anaphylactic reaction, which you can have a reaction anytime you put anything in your body. Right. True anaphylactic reactions are extremely rare. Latest numbers that I have would be maybe 1 out of every 500,000 to 3.3 million. So very low probability for serious reaction.
That's good. And then why do some immunizations vaccines require more than one dose?
There are different reasons. It could be that with some, you just need more doses to get up that proper response that you want. Some vaccines might require a booster as immunity sort of wears off a little bit, and the booster just kind of gives a little jump start, and they produce an immune response more quickly after that booster. Some vaccines, one that comes to mind is MMR, just might not take in everyone during the first try, and so a second dose assures that more people are vaccinated. properly protected.
And then if a vaccination, immunization is missed during a certain time period that it's required, can it still be given at a later time and age?
Yes, for the most part. It might vary a little bit depending on when one is missed and how old the patient is when the vaccine is missed.
Okay. And then, are there times when it's best to wait to get vaccinated?
As a rule, no. We don't recommend waiting, changing the schedule. But there are some times where you might withhold the vaccine. During pregnancy, some vaccines are not given during pregnancy due to concerns, not known concerns that the fetus is going to be hurt, but just that they haven't determined that absolutely that it might not be harmful in some respects. Most common reason you might withhold a vaccine would be if someone is ill. Generally, it's termed moderate to severe illness, so there's a little leeway there in interpretation. But generally, mild illnesses, low-grade fever, sniffles, things like that, that's not a contraindication for giving a vaccine. There are some other reasons, like someone with an immune problem, weakened immune system, might not get certain vaccines. I know newborns, a very small newborn, preemie weighing less than 2 kilos, you would hold off on the hepatitis B vaccine until they're a month of age.
And then, can your immune system be weakened by a vaccination?
No. Actually, it's made stronger. I don't know if I would use the term stronger. I'd say more prepared to deal with illness. But no, your immune system's not weak.
And then a lot of people wonder, do immunizations have any reason to cause autism or anything like that? That
answer is no. They've researched this considerably and they found no connection whatsoever. In fact, the doctor that pushed this, he had his license taken away from him, and it was that serious.
And then our last question, why do kids need a vaccine for a disease that may have been eliminated already?
Well, they don't if the disease has truly been eliminated. They don't. The only one that has been officially determined to be eradicated is smallpox. We haven't been giving vaccines for that since the early 70s, probably. Polio, it's been hoped for some time that polio will be eradicated soon. It still isn't, however, and we still do to give the vaccine. We haven't seen natural occurring polio for some time in the U.S., but a traveler can bring it into the country, so we still want to protect it from it.
Right. Very good. Thank you so much.
You're welcome.
And thank you for joining us. Again, if you have any questions, please leave them in the comments. Keep them non-personal, as we don't want to violate HIPAA. And if you need to make an appointment for your child's school physical, immunizations, doctor is available in our Omaha and our Norfolk office. Thank you.